I thank you for being okay with sharing your personal stories as well as your opinions on psychological safety and healthcare team improvements. And the first question was, without naming individuals, and only if you really have one, tell us about one or two experiences that you or a loved one or a friend had with a surgical team, a story that comes to mind. I'm interested in what is the most poignant story to yourself?
I think in positive experience with regards to the team, um, back in the day, 2006, I had a bone cancer, which was caused by the regeneration from my childhood cancer. And my, like, I had to deal with chemo, and at the end of it, I had surgery, which sort of closed my ear canal shut from my right ear and limited sort of how much I can open my jaw because I only had about probably a centimeter worth of the opening at the time. So
Wow.
then, so for about 3 years, I had to wait before I was able to work with a surgical team. My former plastic surgeon that I previously worked with, and as well a new doctor of children's that were able to collaborate with our effort to do a two-stage surgery. So the first stage was in December 2009, and then the second surgery was December 2010. So and that opened up my mouth a little bit more, and also gave me back a little more symmetry in the face. But there is at the same time the plastic surgeon that I previously worked with was trying to do a nerve graft from my leg to my cheek, so the nerves would work again. But the problem was it wasn't successful. The fact that the nerves are too damaged. So, but overall, I mean, I think that was a positive experience I had for a surgical team working together and on creating one thing because everything else went fine. It wasn't the major problem that happened. However, but a negative experience when I just had last year in December was an eye evisceration. My right eye was supposed to be eviscerated because I had problems over a number of years where I sort of gave up, I guess, and was not able, like, too swollen and stuff. So it was in my best interest to remove the eyeball. So went to UBC hospital. The doctor was a doctor that is a colleague of my other doctor, and there was trust there. But the only problem was that because of the pandemic, the restrictions were that I couldn't really go to pre-admission like I normally do. Right, I had to do it virtually. And my concern was because the number of surgeries I've had previously, that my breathing tube or breathing has, or at least the jaw opening has been a big problem in the last so many years. So um, I was trying to explain and be mindful of that because the anesthetist who I talked to may not have been this. I don't think is usually never the same anesthetist that you're going to end up with in surgery, right? So the messaging has to be clear about what to do, what not to do, right? How do you adapt to this individual, different patient, right? So I went to UBC expecting a day surgery. Well, the fact that I walk in the morning and walk out the same day, but lo and behold, all of a sudden I had a problem, and in terms of getting the information, what they said was that as they were attempting to remove the breathing tube from me, I eviscerated, or not eviscerated, I vomited or something. So they weren't able to take the breathing tube out, and they put me for respiratory issues. They cut the breathing tube in and sent me to the ER at emergency, or to VGH. So I woke up, this day of surgery was Monday, or can remember Monday or Tuesday, and I woke up like a day or two later to VGH, not knowing what happened, where was I, right? And so I know obviously if I still have a breathing tube, I can't really talk, right? Because you can't really talk with breathing tubes in your mouth, right? Or in the throat. And so, I'm trying to communicate. I wear hearing aids, so it's very hard to make sure that I had, where there was a hearing aid and stuff, but I couldn't really hear the nurses, what they were saying. And I couldn't communicate because I couldn't talk, right? So I'm gesturing, saying I want to write something. I don't want to write a question now. But the problem was the people, that the nurses there were sort of looking at me and saying, why can't you communicate? And it's like, could they not have communicated internally, like on a chart or something, saying that this person has a problem, has a hearing aid, he can't talk, he can't, like that information was crucial. And the kind of drugs I was given there, narcotics, something were a little more than I was used to. Anyways, I ended up spending about a week in the hospital, and I didn't feel I really needed to. And that, it sounds was a negative experience in terms of getting the required information. And the fact that I had to wait over a weekend because no nutritionist or no one's working on the weekend to measure or to check to see if I can swallow things before they actually give me some whole food, right? So, I mean, a lot of problems here and there, and I thought I could have had a much better experience that I previously had from before, but it was one of the negative experiences. And I kind of question when I did go to the quality care office and a person say, "Well, guys, I need some questions answered." The answer that I got was sort of saying that you had problems. We didn't do anything wrong, right? When I sort of question, well, wait a sec here. I mean, I normally don't vomit if you guys are attempting to take the breathing tube out, but the breathing tube is bigger than what it should have been. And obviously, no one really listened to my problem. And they put it all on me as the problem that I had, that, because, they did everything by the book. And, I really don't want to go back to UBC, especially with people who think they know what they're doing, right? Knowing that quality of care was not as good as it could have been. So,
Well, thank you so much, Vikram, for sharing that. You shared a good experience where, with your bone cancer, they were able to expand the range of motion of your jaw, right? And the first one.
well, the from my surgery in December of 2006, I woke up not knowing that the extent of what they were going to do. So I had limited jaw movement at that time, and for from 2006 till about December 2009, before there was a surgery plan by the other surgical team to sort of open my mouth up a bit more, to give me more of a, I guess, room, right, for eating and stuff like that. So it was never to what it was before the surgery. And
Mm-hmm.
I had more of that, but to me, it wasn't. It was a more positive experience knowing that I was under the care of people that I was able to connect with and trust and stuff, right? Whereas
Mm-hmm.
I'm concerned saying that because of this whole pandemic, everybody's thoughts are elsewhere, not necessarily where they need to be. But at the same time, what had happened to me should not have happened. I should not have woke up in a different hospital because
Mm-hmm.
my cousin who dropped me off in the morning, especially to pick up same place, same time, or the same place, right? Not at a completely different facility in VGH. We're in the middle of a pandemic for all God, right? And you're in the lobby in a makeshift ER. Right? It's like, you really don't want to be there. And yet, in terms of getting answers, no one's really able to give a straight answer of what had happened, right? Because apparently it said when they were taking the breathing, like from what I got in terms of that, was that the attempt to take the breathing tube out, I vomited, and they're concerned from the vomit went in my lungs, right? And so that's why they decided to keep the breathing tube in me, right? Beyond that, I mean, yeah, I just wish I could have, normally I've been able to communicate and to let everybody know what's going on. But being at that point, being in the bed in the middle of a building, not knowing where you are, what you not have to communicate and let everybody know that you're okay,
Mm-hmm.
right? The
Yeah.
rail running around, right?
So I hear that, there's some challenges with team members communicating to other team members. The pre-admission anesthesiologist communicating your unique anatomical challenges from your disease with the breathing tube and the jaw movement limitations to the next anesthesiologist who might be actually doing the surgery, who might be a different person. And then from there, communicating to you or your loved ones what happened in the surgery that caused the vomiting, you know, and then from there communicating to you or your family why you moved to a completely different hospital from the time you were put under general anesthesia to the time you woke up. And then and then people, the team members, having the awareness or the consideration to know that you didn't have your hearing aids, so you couldn't hear very well, and you're not able to speak but while intubated with something in your throat, and that you would need some extra assistance to communicate. Um, but you've been very gracious in acknowledging that this is a pandemic, and in that time, maybe people's minds were elsewhere and not able to meet your needs. But I can see why that was a really challenging experience, and it seems like it did involve some gaps in team communication for sure, and communication with you as well, right?
Well, that is, I see, Lawrence, is that seems to be a problem with everything. Communication is a basic principle, and the way we communicate with each other is, I guess, can be looked at as a basis for a lot of the world's problems right now.
Yeah.
Poor communication. When we're brought up and go to school, we're taught how to communicate effectively. Yeah, but once we grow up and become adults, and you know, like the laziness of communicating or the way we communicate is not there anymore. Right? We get too busy trying to do our jobs and we forget how to communicate effectively. And the problem, I understand the system is the way it is, but people that are making the decisions are not considering these problems, right? How to communicate effectively without having everybody has to get a certain number of hours in. You have unions dictating how much pay increase is for every year, right? All this other stuff is going on. There's so many bells and whistles part of this, and it's like, nothing really functions well together anymore, based on what it is, what healthcare is supposed to be. I mean, the healthcare is genuine care and health, like your proper health, right? Not only just the physical health, but mental health, right? And that again, I mean, that's why you're in your role as what you are. That's why you became a doctor, because you wanted to be able to help people heal, right? Help with their healthcare, right?
Yeah. So what I hear is that we we have gaps in our system a lot with communication, but we might not be focusing enough resources or time to that type of communication. You mentioned something about financial considerations that are impacting that. What did you mean by that?
Well, just that, I mean, like the politicians and everybody else, the decision makers, the people, the head of these authorities are not really considering the bottom line or the front line people. I think there's a disconnect there. I've seen too many layers of the cake, so to speak, the bureaucratic cake, the fact that once you have too many layers, you can't really see anything from top to bottom. And my concern is that the politicians are coming in and they don't necessarily have the experience of being in the system in the first place, and yet, because the way that the premier or the prime minister changes chairs, right, or changes head of the ministry every year or so, right, or does like cabinet swap, whatever. I mean, getting things done is very hard to get things accomplished, right? Until we have people that are there for long run and continuity. Because I mean, the way the politics cycle works is you spend 1 year learning a job, you spend two years trying to do your job, and then the fourth year is always about getting back to re-election, right? So in a sense, politics only every 2 years, right, or 2 years worth of work. So
Thank you for that. So Miranda, thank you for patiently waiting on the sidelines. And do you have any thoughts listening to what Vikram said? Does any of that relate to maybe something that you've experienced?
Yeah, definitely. I think, like Vikram mentioned, communication is a huge part of everything, and it's often lacking within the medical system. And I've definitely seen that in many of my experiences, and not just communication with me and the healthcare team, but also between the team and my other medical teams. it's really lacking. So in terms of like a positive experience that I've had, so I have many different medical issues and have had many surgeries. My first ones were due to a congenital issue I was born with, and I had to have surgery to lengthen and straighten my leg because of it. So that involved like many really painful surgeries from the time that I was really young until a teenager. And I never really like, I don't know, I didn't really have a very difficult time with those surgeries because, especially in pediatrics, it seems that um, healthcare teams are a lot more patient. They're more mindful and more present and more open to um, hearing a child's questions, to answering them, to making sure a child is comfortable and feels heard and feels safe. And so a lot of that was there when I was a child. And so I didn't really like it didn't impact my mental health very much having to go through all those surgeries, because to me it was just part of life on one hand, and then on the other hand I also had this really great team that allowed me to feel safe. And so as I got older and needed more surgeries and had other health issues come up, I saw that kind of care and communication and team, it just kind of all faded away. Um, it seems like with adult patients, healthcare teams are much less likely to do those things that they would with a child. And yes, on one hand, like adults, they're more, um, they can understand situations better and they can maybe cope with things a bit easier, but adults still need that same communication. They still need the doctors or other medical professionals to be present and there with them and to answer their questions and to help them feel safe. I feel like it's kind of assumed that an adult can find all that on their own. Like, so when I got older and was having other issues, it seemed like um, everything was just kind of happening around me and happening to me. Nobody was hearing my experience. Nobody was communicating with me what was happening. So there was just that huge disconnect. It was like I was totally separate from everything else going on, even though it was all happening to me. Um, so, yeah, in terms of like negative experiences, I've had quite a few, unfortunately. Um, when I was getting towards like no longer being a teenager, I had gotten really sick and ended up having like an infection and needed surgery to remove my gallbladder because that was the source of the infection. But I was too sick. They were worried about sepsis. And they also, like, since I was kind of in between pediatric and adult care, I was on the pediatric ward at one hospital, but my surgeon for my health issues was at a different hospital. So the hospital was trying to communicate with that surgeon to have him do the procedure. But he was not answering the hospital's calls, my doctor's calls, my family's calls. It was like 2 weeks we did not hear anything from him, and in that time I should have had surgery, but it didn't happen because there was no communication. And this surgeon actually ended up um, causing me a lot of difficulty and not actually treating the situation properly. And it went on for a few years. Um, Initially, we just thought it was like that my health was really complicated and that it was something I would have to like repeatedly go through, having these different procedures and things. And each time I'd have to go into the hospital, I would have that experience of not really understanding what's happening, not being heard, kind of just things being done to me. And over time, it just like didn't make sense anymore. We were like, why does this keep happening? Basically, I was having what we now know as Crohn's disease, but at the time, the surgeon that I had kept saying, oh, you have complications with your common bile duct. We need to do this procedure, that procedure. And so it just went on. And then eventually I found out that the issues he was saying that was happening weren't actually happening. It was actually a complication of the surgery that he had done. And so it was kind of like that was all kind of hidden. It wasn't talked about. So either I'm not really sure what happened, because by the time it all finished, it was like too late to really do anything about it. So either he just wasn't communicating, or I don't know if he was trying to hide it. I'm not really sure what happened there. But like whenever I had a procedure with him, it was always like pretty awful. There would be like complications from it, and then I'd have to stay in the hospital. And once I was in the hospital for 10 days and didn't see him the entire time. I should have been on the ward for like GI stuff, but because of like lack of space on the ward, they had put me on the orthopedic ward. And so they never were able to get him to come by. Eventually, near the end of my stay, a resident finally came and he was like, oh yeah, everything's good, you can go home. But within that 10 days, yeah, I didn't see him, we didn't hear from him, the nurses couldn't get anything from him. Basically, like, yeah, nothing was happening, but I was really sick and we had no answers. So eventually, my mom called his office and somehow got his cell number. So she called his cell number, and I guess he was really angry and saying he's in the middle of a lobster dinner with his family and wants to enjoy it. And she told him that she'll have to make a complaint if something isn't done. And basically, he told her that if she makes a complaint, he'll ensure that I don't receive care at that hospital and that the issue wouldn't be resolved there. So yeah, after that, we eventually like saw the resident. He said, everything's great, you can go home. But still, there were no answers. So this went on for like 5 years. And then, yeah, nothing really happened in that time, but there was all these things done to my body that I still don't really know what happened or why it was happening. And I feel like the surgeon also wasn't just not communicating those things to me, but also to the rest of the healthcare team. So all of that, like in the end, like really affected my mental health. And I now like have PTSD from that. And so now having PTSD because of medical experiences, anytime I do have to go to the hospital for surgery or some kind of treatment, it's a lot more difficult. So I need that patience from medical staff even more now, and that communication even more, and the ability to feel safe is really important, or else it's a lot more challenging and then affects me even past when I'm physically healed. I still have to like cope with it emotionally. And for the most part, the surgeons I've had now have been really understanding of that. But yeah, it's still like communication is a problem, because I'll go in for surgery and the nurse that I see at the start will be really understanding that I have PTSD and like these are the things that help me feel safe when going through these things. and sometimes it'll be communicated to the next person, sometimes it won't. And so kind of like Vikram was talking about, if I'm in a situation where I can't communicate those things, I kind of have to rely on other people to communicate it, and that doesn't always happen. So then it leaves me in a difficult situation where I wake up from surgery and don't know what's happening, and nobody knows how to support me. So yeah. I feel like I just like gave you a bunch of different experiences all in one, but
No, that you told that story fabulously and with a lot of countenance. For me, what that means is that you, even though you have been traumatized, you've been processing that trauma. I think with quite a bit of support, the way that you can speak about that so frankly, without breaking down, without tons of emotion, it shows that you were doing a lot of healing work on your own. Yeah.
yeah, it's definitely been a lot of work, and I'm in a much better place now and able to I want to share my experience so that maybe it helps
Well,
other people learn and know what to do differently.
Vikram spoke about challenges of team communication, members of the team not passing on really crucial information about his unique medical issues that would impact his experience as a patient, um, and often leaving him very alone and not able to express himself, and that's really challenging. And then Miranda spoke of a really challenging case where maybe there was even some ethical issues involved with some of the caregivers, where information about her own diagnoses and treatment plans weren't communicated, and how traumatizing that was for her, and having actually trauma from our health system. So it's PTSD trauma from the actual health system, and then making it actually more difficult for her to engage with the health system in a trusting manner, making every interaction a little bit more challenging. Um, I'd like to get your feedback, Miranda. Is that a good summary of kind of what you just shared with us?
Yeah.
Reasons that I'm here, like I feel like I had a similar experience to Miranda.
Mhm.
A little bit of PTSD from my experience directly
Mhm.
related to the medical field. And yeah, in order to, like, I really just appreciate the opportunity to share that, to give feedback to the right place,
Okay.
and hopefully make some positive changes for everybody that comes from here
Okay.
on.
Well, thank you. I do recognize that it is giving of yourselves, all of you guys, for volunteering time to be here with me and to share these stories. And so I'll start with my introduction, and then we can go a little bit around. I'm a family physician for about 12 years in Surrey, and I see myself as kind of a connector. I try to connect some of the patient experiences and feed that back in a loop to my colleagues in the health field, because I think that a lot of times we don't have access to feedback in an appropriate fashion. In the hospital system, I know feedback is pretty sparse. People are just focusing on the do, and they don't actually get that feedback loop of actually how was that experience, or how did that go for the patient. So that's part of, I think, one of my missions in my career at this point. Um, I'm a family physician in Surrey. Um, Miranda, why don't we go to you? Just reintroduce yourself briefly for Lauren.
Yeah, so I'm one of the patient partners with Patient Voices Network, and I've been involved for a few years now. Just really enjoy having the opportunities to use my experiences to hopefully change things for other people. And I'm in Maple Ridge.
And Vikram, if you have time, if you wouldn't mind introducing yourself again.
He's away for a second. He said he would be right back in the chat.
Okay, sounds good. So yeah, you go ahead, Lauren, and you introduce yourself.
I am close to Miranda. I'm in Mission, BC, and also part of the Patient Voices Network. This is technically my first project involvement. I kind of joined just before COVID, and then everything was kind of like, So then, but then I was just really waiting for opportunities that spoke to me, and this one really speaks to me because of my past experience as well. So I'm excited. I just really am excited that this process is in place so that there is a feedback loop, because as we all know, our health system really does feel like it runs at a deficit, and feedback is an additional step that isn't really life-saving in some situations, so sometimes isn't factored in. But I do feel like it is really important when we're dealing with people and human individuals to really understand how we're affecting them in those moments, especially in some cases, it could be the worst moment of their lives. So just understanding how we affect that. And also I feel like there's a lack of applying that knowledge to the situations. I mean, our healthcare field does such a great job of doing so much research to understand how best people learn, but then in the setting, they only tell it to you one way. They don't say, are you an audio learner? Are you a visual learner? Like, do you need this information in a particular way? So I feel like there's just a huge opportunity to meet people where they're at and provide the information in a way that makes sense for the individual.
Yeah, Lauren, that's that resonates a lot. We've devoted very few resources to communicating in the most effective manner with patients when healthcare is so important. Like when you compare it to like maybe buying a cellular phone or buying a new piece of furniture, those industries have actually devoted quite a bit of resources to the communication and informing people, their clients. But in healthcare, we haven't done enough of that. That resonates a lot. Hi, Vikram. Are you okay with introducing yourself briefly to Lauren, just so that okay.
Yeah, I think part of the problem, Doctor, yeah, or I'm saying Lawrence, I guess. Before I go and introduce myself, was more about. I think I don't know if the system has changed, but the education system of the healthcare professionals has always looked upon the patient as someone who's to be treated, not really to listen to or to effectively understand them, right? Because you have to treat us effective like objects versus subjects, right? The fact that the human part of it is the biggest concern from at least what I've heard from Lauren and Miranda so far. The problems are human related. These are not, because we are robots that we need tuning up, right? So I think a matter of understanding that aspect and not, like I'm surprised, I was really surprised to hear Miranda's experience in terms of the bad person that should not have been in the position he was in. And I hope at some point he gets his comeuppance, otherwise I would make sure that he does, right, if anything, because that's what I do. I go after people that are bad that need to be dealt with, but not that I do it in violence or anything, but it's, just sort of I have no problem going up to whoever's in charge, right? But anyways, Lauren, I think from in terms of I think Miranda's and I history is that we've been a part of the system for so long, since our youth. My journey began when I was 5, and since then I've pretty much been in the system for in terms of care. I mean, as a kid, I was treated in Saskatchewan, but then moved out to BC, where I sort of grew up as a teenager and adult. And I've luckily had the same position or same oncologist since I moved to BC, which is great. The fact that she's still the same constants I have, that she really does want to make sure that, I'm doing okay. And up to the point of when she decides to, hang up her coat, I'm concerned as to how long I can have the continuity, just that she's sort of been very kind to have, right? So, because her dedication is there, and that's something a lot of us don't have, is the continuity of someone, right? And the genuine care, which is what we're looking for, because the terms health and care, health has got to be encompassing of mental and physical, and care is general care, right? We know how to, like the same way we care for each other as family members, as friends, right? It's just that's the general care we need for, not the kind of doctors that are there to, or the people that go through med school because they want to have money and they want to, drive convertibles and marry a beautiful wife and then, forget who it is, what they're doing, right?
Well said, well said. So Lauren, I guess, Lauren, you shared that you've been hurt by our health system too. Maybe, I don't know about physically, but you said it was almost like PTSD, almost like a trauma, a psychological trauma from our health system. Would you like to tell us about that and tell the YouTube audience for that right now?
Yeah, of course. I was diagnosed with Crohn's disease in 2010, and I had like Vikram, what you said about having a healthcare professional that creates continuity of care, and in a way that involves you in the care aspect. It wasn't there for me, and I feel like inadequate care led to the degradation of my Crohn's disease to a point that it was only able to be helped with surgery. So, and that wasn't determined until I decided to get a second opinion. And so I went to a new gastroenterologist, and that gastroenterologist, upon the first meeting, was like, I'm going to send you to a surgeon. Send me to a surgeon. And the surgeon said, it's not a matter of if you're going to need surgery, it's just a matter of when, because your bowels are so not doing well, irreparably damaged, I believe are the words that they said, that at some point it will something bad will happen. So they scheduled me in for a bowel resection. So at that point, I was already heavily malnourished, massive symptoms, and a huge blockage of inflammation on the right side. So I went into St. Paul's for a routine bowel resection, and it, for all intents and purposes, went well. I went in, it was laparoscopic from what they told me. But over the course of the next 2 days, I was so malnourished that I guess the connection point of my intestines failed, and I went sepsis in my body cavity. And then after that, I was induced into a coma. I was put through multiple surgeries. So after that, I was in ICU for 12 days. I was operated on multiple times to try and see if they could repair that, cleanse my body cavity, all of that. And it was unfortunate. I definitely see now, looking back in hindsight, of course I was very malnourished and it definitely didn't work. But the way that it rolled out after that was really difficult. I was put into ICU, so I wasn't really there for the worst part of it. I kind of feel thankful for that part. But the uncertainty for my husband, for my family, was really difficult during that time. And I know that just trying to get proper information in an empathetic way, there was only one surgeon that really connected with my husband and kind of talked to him about exactly what was happening, where everybody else was quite clinical and refused to make any movements. But it was this one surgeon that actually connected with him and let him know how bad it was. And it was to the point that, I could have passed away. So they decided to put in an ileostomy while I was under. They continued to try and close me, and that didn't happen to the point. And the miscommunication with my family resulted in finally it getting to the point where they were like, why isn't she being woken up? Can we at least wake her up, even though she's not closed? So they finally woke me up, and the way that went was pretty traumatic for, I think, all of us, because you're on so many medications personally, and then your family seeing that without that context, was very traumatic. So I was pulled out of a coma, but I was open. They still had that plastic plate in me. They still weren't able to close me. And then there was this uncertainty of when, and then it was like, oh, well, you're scheduled for the surgery. And then it was like, yeah, you're not going to get it today. And then you're not. So anyway, finally had my surgery. They were able to close me as much as possible, but obviously the ileostomy was the saving grace out of that. And then I was in the hospital for another month after that, just recovering. The parts that I found that I struggle with today are, just there's no continuity in care. And because the system felt so overrun, I didn't feel like anybody really generally cared. to the point that like I had one of those wrist bracelets on saying that I was allergic to a certain type of tape. Every single time a new person walked into my room, they would try and use the wrong tape. They wouldn't even look to see what allergies, what was required of that. So I felt that really was very difficult. I felt like the communication between all of the teams was really hard to deal with because they would come in at 6 in the morning and I would just be woken up from, you know, all the slumber of all the medications that I was on. And then they would try and have conversations with me. And I didn't feel like I could adequately answer. I felt confused by those communications. I didn't understand the information they were telling me. I have like a notebook where I tried to write down, but my motor skills at that time were not good. So that when my husband or my family came in and I would try and relay the information or the questions that we had come together, there was no flow of information. Like it was really difficult to get that understanding. There was miscommunications with the way that I came off of pain medication through a series of unfortunate events. The way that they brought me off of the pain medication was like, I was like on 4 and then they took me off all 4 of them. And so then my pain skyrocketed and then I was set back, and it was just a miscommunication between different nurses, different departments about what to do and when. I just felt like there was such a lack of trust, and every time I would bring something forward, it would just say like, you know, don't worry, it's supposed to happen this way. But in my case, it didn't. And there was no recourse. There was nobody that was like, I'll look into that. I'll find out more information. I'll get that to you. It was just like, that's what it is. For instance, when I came out of the hospital, I wasn't given pain medications. So again, another setback. When I got home, I was in an insane amount of pain and I had to make my way to a walk-in to get medications. They didn't give me any ileostomy support. So I came out with no knowledge of what to do. And again, that was something I followed up with saying, I didn't get any support. And they're like, well, the system is supposed to work like this. You're supposed to get this. And as much as I reiterated, that wasn't the experience I got, it didn't seem to really matter. Yeah, it just really was, it was hard because it was not an environment I feel like people that need to heal thrive in. And when you're in a hospital and you're just kind of stuffed in the corner, and I mean, the food at trying to get back to eating, food was not adequate, and the feedback for that was never really taken into account, or nothing was really changed. It was just a hard situation to kind of wrap my head around, and also not understanding fully what happened. Like now looking back at it, I see how much the medications affected my mentality at the time, how much they affected my motor skills, like my ability to do all these things. And that wasn't really something that I feel like I was educated about that would happen to me, or that I felt like I was almost made to feel not like I should have had those answers. I should have had that information. When now looking back at it, I don't feel like that's right to ask people in those situations.
So you mean that it wasn't right for them? I think what you're saying is that people made decisions about your health and your medications without including you in the discussion, and then just let you deal with the side effects without informing you what the side effects would be. Is that what you just said?
Yeah, and kind of like Vikram said, like taking the person into account, like taking my feedback into say, this person is feeling this way, so we can either pivot and provide additional information, or like I also feel like I was heavily depressed. So while I was in the hospital, I became more and more depressed, to the point that they were asking me if I wanted to take antidepressants. They were like, I felt like instead of saying, what is it that you actually need? We're going to support you in that, which what I needed was to be at home. And what I could have been supported in was home health care. But instead of that, they were saying, do you want antidepressants or do you want to go to a different hospital? And I was like, if I need to be in the hospital, I want to be in the best hospital. But if I can be at home supported by home care, like that should have been presented as an option. And even when I went home, when I did, because it definitely was this balance of, I'm falling into such a depression that I felt like I couldn't stay there. I probably went home much too early, but I didn't feel safe in that environment. I didn't feel heard in that environment. And so many of so many of the things in a hospital, like just getting outside or seeing your friends and family, or those kind of things that aren't directly related to your health, but are so related to your mental health, weren't really addressed. And even when I went home early, they never provided me home care. Like I had to go in for wound care 2 times a day and had to go and do my own IVs. And then I learned after that wound care is an option that people can send home. Well, what happened in my situation? Like, why didn't somebody adequately see what was going on to provide that? Another situation that happened was I was readmitted slowly after. Like a week after, I had an appointment with my infectious diseases doctor, and he readmitted me. When I was readmitted, I was put into emergency. I didn't have access to food. I didn't have access to my medications. So I was like all set behind just to get admitted. When I was admitted, they gave me IVs, in which that's what turned out to be the problem, is that I was highly dehydrated and I didn't have the capacity to intake the water that I needed. Nobody noticed that. My doctors didn't notice that. Nobody in the hospital noticed that. The person that made the recommendation as to far as putting myself on IV fluids daily was my insurance like case manager that is in Alberta that doesn't even see me.
Wow. So
And
you were so dehydrated that you couldn't even drink. Like you just needed that basic level of function in order so that you could actually be alert enough and strong enough to bring a mouth to your lips, kind of thing.
well, I couldn't intake enough water that I actually needed. Like my stomach and everything was just so small. I didn't have the actual capacity to drink what I needed. And they just kept on telling me, drink 2 liters a day. And I'm like, well, that's easier said than done in my situation. And if I'm consistently saying that that's not something that I can do, this seemed like a really easy fix that immediately turned everything around, just getting that hydration and starting me off from that ability so that I could actually get to the point where my body could heal. And so just having situation after situation like that, where it just felt like that trust was lacking, saying that feedback, having that dismissed was very difficult. And then I eventually had a reversal surgery at the same hospital. And I remember in the intake and everything, they were like, what's the problem? And I'm like, I'm nervous. I'm nervous that it's not going to go the way that I'm not going to be treated like an individual, that my specific case isn't going to be seen and that they're going to miss something. Like I'm nervous that I'm not going to be cared for in a way that an individual needs to be cared for, rather than just making sure that boxes are checked, or, and that's also what I saw from the healthcare system while I was in there, is just those poor nurses were completely overrun. Like just scheduling in showers, an ability for myself to get a bath was an ordeal. My husband's listening to hockey. But like that was really difficult to actually get. And that was
I thought he
something
was cheering about you showering, getting a shower.
He was like, yes, finally. But just finding time, like it felt like it was something that I had to shush you. That was something that I had to, and I feel like every point along the way, things that made gains was things that I just had to stringently put my foot down and say, I need a shower. Like if you don't schedule it in now, when is the next person going to be able to? Like, because it felt like they were always overrun, that they didn't have time to fit in things like that in a timely manner, because they were always working at a deficit. And it really makes me feel like if people aren't as vocal as myself, like, but if people aren't as vocal, or if they aren't watching like the tape thing, what is going to happen to them in those situations versus somebody like me that is going to say, don't use that tape on me. You didn't read the chart, like make sure. And the same goes for even when they would do the wound care, and I would just get to know what the sanitary processes are. And then somebody would come in and not follow those processes and not use the right gloves. And then that would be on me. But in doing that as the patient, that makes you lose that much more faith in the system. And the way that it needs to be heard is to say, yes, you had this experience. This is what we did to address it. This is the situation moving forward, not placating people and saying, well, this is how it should be done. And we hear you, but you don't really see any action or anything happen after that. So yeah, it was difficult. And it wasn't until like 6 months ago, I think, that I actually, in talking to my counselor, actually recognized that I had PTSD from it, that just from the experience, even walking through the halls at St. Paul's, like it's just like it evokes something in me, just because the experience at the time was just so conducive to what I expected going in. Yeah.
So counter to what you expected going in. Yeah. Like you went in there trusting people with your health, and then it seemed like, wow, I actually have to try to be alert and vigilant and advocate for myself at every point of the journey. I can't imagine how exhausting that must be.
Yeah. Well, sometimes you can't advocate for yourself, right? If you're by yourself, you can't advocate for yourself all the time. Sometimes you're incapacitated and can't prove that or say that you have all this because from what Lauren has shared in her story, thank you for sharing, Lauren. I think the breakdown, obviously, we said was communication. The fact that no one is really doing their diligence to make sure they are dotting every I and crossing every T of whatever it is they're supposed to be doing, right? If you have an allergy, it's supposed to be number one, that like a red flag. That's why it's red on your chart. And now, if they're not having charts anymore, where do you have that? Where is that notification, like a blank window that pops up saying this person has an allergy? Be sure to listen to them or be able to see whatever it is, right? And like it's like an alert to remind them to do their job, right? It's very frustrating.
Thank you, Vikram. So from hearing all three of your stories, some of the common themes are strong lack of effective communication within the healthcare teams, resulting in a significant amount of distrust and loss of faith in our health system, making your journeys a lot more challenging, and actually making it therefore more challenging on the teams because they don't have your trust anymore, understandably, after going through what you've been through. So question number 2 on our list was, what do you think is important about how health system team members relate to each other? Like, what should the team members have when they relate to each other in order to kind of reduce some of these traumatic experiences patients are having, such as yourselves? And I've heard stories similar to your guys's before in terms of how it doesn't seem like the system that we currently have is working. So how important, what are the important things that if I was part of a team member, if I was part of a healthcare team, and I am, what are some of the important maybe behaviors or values that the team members should have? And you mentioned one of them, Lauren, that you felt that people were overrun, that you said they were working at a deficit. Maybe I'll start with you. What did you mean by that? What does working at a deficit or overrun mean to you?
Well, it just means that the nurses were working at overcapacity. They had too many patients and they couldn't give the adequate amount of care to each person that was needed, or individualized care for that matter. So if they had, something I'm learning, I'm going into leadership, and what I'm learning is, like, to run an effective team, there is a max amount of people that you can have underneath you that you're in charge of. And I feel like, and then I come from the rescue world, and there's this idea within rescue centers that you have a capacity of what you can care for. If you have a capacity for 50 animals and you bring in 100, you're providing a lower amount of care across the board. And yeah, I feel like nurses are always kind of working from that place, like not only the schedules, like I applaud them for wanting to do those 12-hour schedules because that's crazy, but just the amount of work that's expected of them during that shift doesn't leave any room for showers, planning in, or getting, even, there was only one nurse that I can think of that actually tried to get to know me, to understand me and my family, because I don't feel, and that was in the ICU, which was, I wasn't really there for, but I feel like there's no capacity for that, to individualize the care when nurses are running at overcapacity.
Thank you. So they definitely need capacity. They need appropriate kind of like job boundaries or shift boundaries or adequate staffing. The team needs that in order to do a better job.
Yeah.
Anything else that you can think of, maybe in terms of from your studies of how team members ought to relate to each other that might.
Well, I think what Vikram said about like having a base person to go to that is the point person. Like, I think that when you're in a hospital setting, that person changes constantly. And it depends on if it's the surgeon that's taking care of you, and if that surgeon is off and it's the other surgeon in rotation. And then you get passed on to other teams. And by passing it along, I think it's important to have all of those specialists that have their own degree of knowledge to look at you. But when you don't have somebody kind of stick handling all of that information, it can become, it can just be people talking to you and telling you their opinion as opposed to actually being a patient receiving individualized care.
So yeah, Vikram mentioned continuity. And so even within the hospital, continuity in the hospital, someone who is a familiar face to you, hopefully a trusted face relating to you, what's going on, what are the updates, what's happening next, that kind of thing.
Even contextualizing the information from the other departments. Sometimes it feels like individual or specialists individually are having their look, but just somebody to kind of pull those pieces of information together to answer questions. That was a hard thing to get done in anything, because generally by the time you asked a question, that person was off and somebody else had to ask, or if you asked a nurse from the shift before, just relaying that question to the appropriate person and getting an answer that made sense back was just really difficult. So even just having that continuity between, having it between departments, or somehow a communication line that brings that all in. But I feel like that is something that hospitals do well. And because there's so much information, that's why somebody reviewing it quickly isn't going to gather all that information. Rather, if you had somebody that was maybe assigned to that person to absorb all that information and contextualize it to everybody else, but as well as to the patient, would just be it would have been a world of difference, because I feel like a lot of things maybe would have made a lot more sense or wouldn't have been dropped like they did.
Yeah, what I hear from you is maybe an idea of a knowledge translator, or a some of the things that happen are quite complex: medication names, side effects, procedures. So even like a literacy broker for these types of issues.
Well, and even like I said before about people absorbing things in different ways, like we all contextualize information in a specific way. So all to say, like, it would have made a world of difference if in the morning when the surgeons came and asked me questions and gave me information, I got a printout of that after that I could then give to my husband and my family when they came in to say, this is what's happening. And then it's just a way for them to create feedback, because it always felt like we were chasing people to get that information.
Thank you. Miranda, I'll go to you since I think Vikram has to step away. What do you think is important about how health system team members ought to relate to each other?
I definitely agree with everything Lauren has said. And yeah, I think medical professionals, they're often, each person is like, this is my role, like this is my specialty, that's what I focus on. And there's not communications between specialists or adequate communication to nurses. Like it seems like everyone's kind of always doing their own thing and not working together adequately. I'm sure like there's obviously some communication, but it's clearly not enough. And I've had so many times where I'll see specialists in the hospital and then ask the nurse questions, and they'll be like, oh, they didn't leave us notes about this. We don't know who came to see you. Do you know who saw you? Do you know what they told you? Do you know what the plan is? And I shouldn't be the one that is being asked those things. I should be the one who can ask other people those things, especially if you're really sick and you don't have the capacity to manage all of that on your own, but the expectation is still like put on you. I've had that experience so many times. And yeah, so I think definitely communication is needed. There needs to be better systems of communicating between people, of um, keeping information together that's accessible by a patient about their own health. It's shocking that that's not available. And also ensuring that information is passed on to family members who are part of the patient's care as well. Um, yeah, like Lauren said, my mom would want to know what's happening, and I'd talk to the doctor, but then I wouldn't know how remember how to pass that on to my mom. Or she would call and ask for information, and they'd be like, well, you have to get it from your daughter, like, you know, we can't release that to you, and things like that. And then I'd be in a place where I'm like, I don't know, I was half asleep when the doctor came in, so I don't even remember our conversation, like, no matter how hard I tried. So yeah, there's definitely so many gaps there that could be filled with communication. Um, and then I think also, like, um, it seems that like healthcare professionals, they're all so busy and focused on like what they have to do, all the things on their list, and what their role involves, and um, don't often take time to just be present and be like, okay, what does this individual patient need? Um, how can I be present with the rest of the team in addressing this individual patient, and not just going by like yeah, kind of like Lauren was saying again, being like, this is what's supposed to happen, we'll just follow that. And then like what do you do if that's not what happens? There's not enough communication about that. Yeah, I could just list so many things.
Miranda, you've mentioned a few times about the healthcare professional being present. What do you mean by being present? I think there's a little bit more to just that word for you.
Yeah, I think often I get this feeling that even though a doctor or someone is in the room with me, giving me information or trying to answer my questions, they're not actually there. It's like they're thinking about the next thing that they have to do, or I'll have a list of questions to ask, but they're slowly like inching towards the door. Like, I don't feel like they're actually there, ready to talk to me. Sometimes I don't feel like they came prepared with all the information. It's like they're always on to the next thing, that they're always thinking about something else. And because of that, I've had where they give me the wrong information, they don't answer my questions, whatever's happening, they don't become aware of soon enough. And then I get sicker because they weren't present and able to notice those things. Um, like one of my hospital stays, I had surgery, and after I just wasn't getting better, like we couldn't figure out what was going on, and they kept doing more tests, but because the staff weren't present enough to be there and hear my experience and pass that information on or work together, they missed the fact that I was actually experiencing a reaction to a medication that was also interacting with another medication. And that's what was making me sick. And I kind of noticed that myself, and I was trying to explain, like, this didn't start until we tried this medication, or like, these are the symptoms I'm having. It's like they weren't present enough to hear all of that. And if they had, I think it would have been resolved much sooner. And I think there's also like part of it is trusting a patient's experience and what a patient is saying. I think often healthcare professionals have an idea in their head of this is how it's supposed to be. This is what I should expect after this surgery or after this treatment. And if they're hearing different from the patient, they don't trust the patient. It's like that, oh no, that's not how it is. Like, this is how it is. But then that's where they miss important information, or then the patient experiences a setback, and then that puts extra pressure on the system because people just weren't present enough to notice what was happening soon enough.
You brought up a great point about how if health professionals aren't present to maximally do the right thing for the individualized care at that moment, it results in knock-on effects of potentially more work for the system, in terms of that patient's issue was not solved with that encounter, and that patient will have to have multiple other encounters to try to solve the issue that could have been solved earlier on. So there's actually potentially efficiency and effectiveness in spending the time to be present, investing the energy in being present and listening, and not invalidating the patient's data, the information the patient is sharing with us.
Mm-hmm. Yeah, I think patients are like, they're the professionals on their own body. They're the ones that are experiencing it. They're the ones noticing each change or each improvement, each thing that worsens, trying to keep track of what's being done to their body, whereas all the different professionals involved are only focused on their individual roles. And so a patient is trying to bring all of this together for people, and if they're not being heard, then yeah, it'll delay things. And then what else was I gonna say? Yeah, just that yeah, if a healthcare provider can spend just a couple more minutes with a patient, that can then down the road lead to less like things that take longer to resolve. Yeah.
Thank you. So our third question was, in reference to your experience, what gaps might seem to exist in the training of health team leaders? That's who's going to be listening, hopefully, to this conversation. So what gaps in training might seem to exist in the training of health team leaders? And Miranda, would you go first?
Sure. I think one gap that it seems to starting to be like addressed more often is patient and family centered care. And yeah, I see that being more involved with patient partner roles. However, sometimes it does seem like patient partners are there so that the professionals can be like, hey, we consulted a patient partner and this is what we're doing. Exactly, just check off the box. And yeah, sometimes I feel like I'm there, but I'm not being heard. Like, they already have a plan for what's happening, what they're doing, and then I'll share my feedback and they'll be like, oh, great, thanks for being here. And then I'll either never hear from them again, or something completely different will happen. And I'll be like, wait, that did not like involve any patient consideration. So yeah, I think that's one thing that's lacking, is knowledge on patient and family centered care. And then also like knowing how to bring that into practice and what that looks like, not just knowing that, oh, this is an important thing, but like, how do we use this information? How do we appropriately address this? And then I think patients need to be involved at every level of everything, because they're the ones with the experience, and they're the ones who can bring knowledge that might not be thought of by other professionals. Like we're professionals on our own. We're the ones who are accessing your services, and we should be acknowledged more often and heard more often.
Thank you. And in our system, in our public system, we are all the ones who pay into the system, and it's a patient-owned system, to be honest. And you are consuming and owning it. So yeah, you should have a say. Vikram, I don't know if you'd like to add into this one. The question was, in reference to your experience, what gaps in training might seem to exist for health system team leaders?
Well, before I answer that, I think responding to the reader's question, because I don't think I have a chance to, but when Lauren was mentioning about the PTSD she experienced within the system, for quite a while, I mean, yes, I've seen the same colored walls and everything wherever I go, right? Apparently, Topa is very popular still. So I think the ambience of these health facilities needs to change, because part of that trauma is relived, not only just for, any sort of health experience, cancer or whatever you call, right? And I think that needs to be changed. I think ultimately, tying into the question about the training, I think it's a matter of understanding who the patient is and what their role is, and that the fact that they're not there to know it all, right? They're only there to share what's concerning about, what are they concerned about, right? I'm agitated every time I walk into some other facility, an outpatient facility or something. Someone asks me, what medication am I on? And I thought, well, this day and age, don't have a computer that can tell me or tell them that I have these, or they're just confirming, saying go rather go through this rather than me trying to remember what medications I'm on. I mean, it's just part of the genuine care and respect that they have to have for the patient, and they cannot. They have to put aside, learn to put aside their biases of a typical patient, right? Because from what I heard from Lauren and from Miranda, that the doctors seem to be memorizing the textbook in their head of what their textbook told them to do, right? And so they're not able to train or to think objectively or subjectively if they have a new case that arises, right? Life is not predictable, and the problem is that there is a system that it seems to be that these people are taught a certain way, and to think that, everything's going to go hunky-dory, not understanding that there are many different cases out there and not everybody is the same. Not everybody can be typical, right? I mean, when it comes to, Lauren and the Crohn's and stuff, I mean, it's not a typical Crohn's thing, right? With Miranda's case, I mean, it's not as though the people are think they know everything, right? It's a matter of them actually really listening and hearing, actively listening to what it is that the patients are trying to share and to saying, this is what happened with me. What are you going to do about it, right? I mean, the problem, I think, as much as we are sharing our stories, the problem is actually listening and actually moving forward with an action of what's going to happen next time, right? Because next time we may not be as lucky as we were to get through it, right? And that's the worst thing we always think of, right? But the idea is that, the idea of life is supposed to be learning from your experiences and grow and adapt accordingly, right? Not to do the same thing over and over again that you've done for decades, right? I think that's the biggest problem, I think, that we think. I mean, people grow up a certain way, and there's no way until, you can't really change that person, but you can maybe try to think differently, right? I mean, I know you've heard, I'm sure people have heard about the biases, the racial biases of what's going on, right? I mean, you shouldn't happen. The idea is that if you're in this one country right? No matter where you're walking in from, right? You're walking into a health facility looking for help, right? And you should be treated as that, not treated as if you have a, there should be some flag. I mean, if you're a current, like I would say, if you've been a patient that's previously gone through the health system, right, you should be flagged as that rather than everybody walking in off the street as brand new, right? It has had a clean bill of health before they walked in, right? Because obviously my cases have always been about problems that I've had later on. I mean, I had like Lauren mentioned about a bowel resection. I ended up having one, right, last January, and later on, I mean, I was worried about the fact that it may have ruptured, but luckily it hasn't as yet. But going forward, hopefully I have enough diligence to know what to do. That does happen. Yeah, and hopefully that answers your question, Lars.
Thank you, Vikram. I want to acknowledge that we scheduled this until 6 o'clock. I'm okay to go on for another 30 minutes or so. Are you guys okay to stay on for another 30 minutes, or we can reschedule a second part? What do you guys? I'd like to hear what you'd each like to do. Lauren, how do you feel about staying on for another 30?
I can stay for a little bit longer if need be, or I can reschedule as well, whatever works best for everyone else.
Miranda?
Yeah, same with me. I can stay on or reschedule. Others fine.
And Vikram?
Yeah, I think I should be able to hang on for around 30 minutes or so.
Okay. We have two. I think I'd like to get to Lauren on question number 3, and then we have 2 more questions. And the 2 other ones hopefully will fit within 30 minutes.
Okay.
So Lauren, in reference to your experience, what gaps might seem to exist in the training of health team leaders?
So I went through my health struggles in 2014, and then in 2016 I had my other surgery, and then in 2018 I actually had the opportunity to work at a children's hospice. And I feel like the way that children's hospice care is run should be how we emulate care across the board. What I saw was like some of the things that everybody else was speaking to. The doctors and the healthcare professionals were more educated, and they just had those more human skills, having conversations, how to have that information, how to talk to people about certain things, how to provide information. It was very much a patient-involved system. The patients and their needs and their family were the first expert, and everybody else just signed on to be part of their team. So the care was always directly involved and tailored for that individual. Not only their physical needs, but their mental and emotional well-being as well. Like they also had a spiritual guidance counselor as well if people needed, like everything was considered. And I think even when he spoke to those unconscious biases, I feel like a lot of doctors walk in there thinking, I don't have any biases. But when you're talking to them, they obviously have a bias, thinking that they have the better understanding, they have this knowledge, and then that you don't. So there very much is so many of those biases that aren't just, I mean, I do continuing education for bias training in my role. Is that something that doctors do? I'm not really sure if that's something that's kept up. Education of patients within that, like just educating the patients as to what that's going to look like, what the trajectory going forward has planned, I think would be a huge thing to fill in that gap. And it also kind of struck me, what you mentioned about it being patient-centered care. I kind of find that interesting and almost comical in a way, because if you were to look in any given hospital and looking at the care and looking at the day-to-day and things that break down and how it falls, I don't believe anybody would come out of that saying this is patient-focused healthcare system. I feel like the values that come out of that are very much budget, time constraints, politics, but not so much the health of the patient, the care of the patient, the overall well-being of the patient. That to me isn't something that I see in our healthcare system.
Wow.
Oh, I also want to add, I had this dream, and I think it was like going in for my second surgery of like it being different, like Vikram said, like it being a different atmosphere. In a kid's hospice, they don't look like mortuary, like they don't look horrible. They look like fun, engaging places because people, like the kids are still living going through that. And what a difference it would make if I going into a surgery and it being like a spa-like experience for somebody coming up. Is there anything you need? What can we do? Are you a little stressed? You know, can we relax you a little bit? Why don't you step over here into our, you know, something like that. But anything that would facilitate a more relaxed environment, because I feel like budget and time constraints and overwork and all of that has created these situations in the hospitals that don't really speak to the overall reason we're here. They're just a byproduct of this is what needed to happen in order for us to be able to get everything done.
I think the problem, sorry, Lawrence, I think I don't think like it seems to be that adults are afraid of color for some reason. Color in our work, right? I mean, it's as you can see behind me, I have a blue wall, right? I mean, not that hard to put up a blue wall, right? It's not as though the wall has to be taupe or anything or white, right? I mean, it adds a little more to the room, right? And of course, you guys can't see all the paintings and stuff I have all around my place, so you know, it's not that hard to include art or murals and stuff like that. That the focus on the children's, but not have it at the adult hospitals or the adult facilities. Right? It's very mind-boggling why they think, you know, adults have grown past that stuff when, you know, we're all the inner kid, right? So.
Yeah, I've been to Children's Hospital as well, and it's fun and engaging, and like it doesn't give you that sense of like, oh, I'm in a hospital.
What you said there, Lauren, resonates a lot with what Miranda started off today saying before you got on. Do you want to comment on that, Miranda? You were saying about how your experiences at Children's.
Yeah, my experience as a pediatric patient, I felt so much safer. It didn't feel like I was, like, even though I was going through so many surgeries, I didn't feel like it was this big, scary thing. Like, obviously, there was some difficulties, but when I look back, I don't think, like, that's not something that caused me any trauma. It felt safe and it was a welcoming environment. But then going to adult care, that was all gone. Like what you've already mentioned, like just color or being in a comfortable environment, it was just gone. It's like it's expected that adults can cope with anything and they can meet their own needs, but nobody can meet their own needs when they're stuck in a hospital bed, not able to shower. Like you mentioned, Lauren, with showers, I remember one time I was in the hospital, a nurse came in and she's like, you know, you really smell, you should probably take a shower. And I couldn't even get out of bed on my own. So I was like, I didn't know what to do. Eventually my mom came and I was like, I know I need a shower, but like there's been nobody to help me shower. So my mom helped me, but like family, they have their own lives, and even though they want to be there for you, they have work, they have to still survive themselves, and they can't be expected to be the ones caring for the patient. Usually like my mom would be the one who would bring me food, help me shower, make sure I'm comfortable. But I don't know, I feel like that's something a hospital should be able to do as well.
It should, and I think Children's Hospital does exemplify what is possible, just like you guys said. It's one of the bright spots. It's not perfect, but it's one of the bright spots that we can learn from. You know, Children's Hospitals employs some principles called trauma-informed care or trauma-informed practice, where they're sensitive to the fact that every patient is at risk of psychological trauma, and so that they design the space to be more welcoming, the sounds, the furniture they choose, and how they listen to patients is there. And I totally agree that even though we're in bigger bodies, we are still vulnerable to that fear of uncertainty and stuff like that. And so I think that our health system needs to learn exactly from what you guys have shared today about some principles of creating a sense of safety for people. Question number 4 is, what does psychological safety mean to you? And I know some of it might be redundant, but it's a realm of study that actually the Ministry of Health has been interested in, and our Doctors of British Columbia group, who partnered with the ministry to fund this project that I'm spending time on right now. My time with you today is volunteer as well, but psychological safety is actually the working group that spawned this idea to work on a project where health systems leaders, especially in the OR, can receive some coaching or some education around psychological safety. And I'm interested to share with them what psychological safety might mean to each of you. Vikram, could we start with you? What does psychological safety mean to you?
Well, it's two-part. Again, it's like the treating us with kids gloves, right? Because that's what you do with children's, is that you treat each patient with kids gloves and welcome them with open arms to make sure that their anxiety is not as high, right? And that's the problem that is being misplaced or that is being forgotten, for all these problems that we've had at these other facilities or adult facilities, right? That I think treating people with kids gloves and reducing their anxiety or removing it from the equation. Because at the moment that you walk in or that you're wheeled in to one of these facilities, your anxiety level is very high. You don't know what's going to happen, right? You don't know there's nothing in their brain, or, I mean, you have some idea of maybe what's going to happen, what's going on, but communicating that to the person who's receiving or is supposed to care for you, whether it be the nurse or the doctor, again, they have to actively listen if they can or what's happening, right? Because at some point, let's say, for an example, if you were brought in to the ER by emergency paramedic or an ambulance, right? You would have communicated at some point, either through the 911 operator or to the paramedics arrive at the scene of what's happening to you, right? So they know what needs to be done, or they're able to see what has to be done, right? But at the same time, I think that communication between one person and another person is very crucial, right? I mean, they have to really actively listen to what's happening or what that person is going through. And safety-wise, it's like psychological safety. There must be a barrier in terms of a minimum line of which you can't cross when it comes to certain levels of like serotonin or anxiety or whatever it is, whatever emotion that's there. You got to keep it down by minimum level. And the people at the facility, whether it be the the frontline individuals or something, they have to like there's a minimum barrier in which they have to keep the patient at a certain level, right? So that when you're at that level, you're at a calm moment that you're able to. It's not as though you're walking, it's like you're daydreaming or anything, but just ideally enough that you're able to be coherent and not too worried. I think ultimately, I think that psychological safety hasn't been looked at, but needs to be looked at. It's part of the care. Right?
Thank you, and that's a great ringtone, by the way. Yeah, but I totally agree that we need to manage kind of the anxiety levels of patients when they come into our system to that threshold level, I think, and not increase it by not talking to them or making the environment seem unsafe or unwelcoming. Thanks, Vikram. Miranda, would you like to add something?
Yeah, I think psychological safety comes back to that trauma-informed practice that you were talking about. I think that we would have more psychological safety with more knowledge around trauma-informed practice. But I think also like mental and emotional health needs to be have more focus when someone's in the hospital. There's a lot of questions around how do you feel physically, but nobody ever talks about how someone is feeling emotionally or mentally, or it's completely ignored. I've had like where I'm sharing a room and there's an elderly person in the bed next to me who never has any family come, who is alone. And I've had where they're just laying there crying for hours and nobody asks them how they are. If a nurse comes in, nobody addresses like, why are you crying? They just do what they have to do and move on. If it's not physical, it's not important. It's like, even if it's an emergency situation, um, if someone's mental health isn't addressed, then it'll make everything harder. And I think people would heal faster if their mental health was addressed. Um, like one of my hospital stays, um, I told someone, I was like, I'm not doing well, like emotionally, I'm really struggling with this. And the response I got was, oh, try to think of like, picture yourself on a beach and like how relaxing that would be. And I was like, you want me right now? Well, my pain is like 10 out of 10. You can't manage it. I'm like, have an infection, I'm sick, I'm like on all these drugs, and you want me to picture myself on a beach. Like, I don't think that's gonna help. So I think like responses when patients do say like they're struggling need to be more appropriate. Medical professionals need some training on how to respond in those situations, because often like if a nurse has worked on like a medical ward their whole life and doesn't have any like experience with psychiatry, they might not know how to respond to mental health needs. It's just so much focus on the physical health. And yeah, I think people need to be come back it comes back to people needing to be more present with patients. Like I've seen in the ER where I heard this, like the most recent time I was there, I heard this lady on the phone with a friend, and she was like scared because she was in the hospital alone because of COVID and she didn't know what was happening. And she was telling her friend that they told her she needs an IV, but she doesn't know why, that she's terrified of needles, doesn't want to go through it on her own. And she hung up crying. And like a few minutes later, a nurse just walks up to her and starts putting the IV in, doesn't say anything, doesn't say why she's there, doesn't say who she is, what she's doing. And the patient was just crying, and they're like, oh, what's wrong? Like, are you not feeling well? But they don't say like, oh, are you scared? Like, is there anything I can do to make it better? And um, that's kind of what I've experienced in the OR as well, is they just bring you in and start doing stuff to you. They don't explain like what each thing they're doing is. It's like, it's not, I don't know, it's not thought of. Or like, are you comfortable? Do you know why we're doing this? Are you scared of this? Like, is there anything in this environment that feels unsafe? Like, it's just not thought of.
People aren't, the team isn't creating psychological safety for you as a patient going through it.
Mm-hmm.
Mhm. How about you, Lauren? What does psychological safety mean to you?
Um, I was kind of thinking back to the situation when I was in the hospital and I really was declining, and the way that they went about it, which was basically asking me if I wanted medication or movement. Um, and I think in that moment, the biggest thing that would have made the difference for me is one of the things that you said, Miranda, is just understanding, is that education component of understanding what's going to go through. And I also think of the how many times I've walked into an appointment, or a doctor has come up to me and said, how many times do you do this? How many times, like with Crohn's, how many times do you go to the washroom? How many times do you have mucus in your stool? How many times this? And looking back, I didn't know they were going to ask those questions. So I don't feel like I was properly prepared to answer them, because I'm just coming off the top of my head, and that can be very incorrect at times. But also kind of like it took me years to understand what they meant by mucousy stool. Like, I didn't know what that meant. Nobody taught me until I figured it out somewhere along the line by myself. So just educating us about that information, about what we're going through, about the process, even like, yeah, you're coming into this room and then so and so is going to take over and they're going to walk you through these steps, giving that information. But one of the biggest things I think would have made a difference is just trust. Like, having trust in the system would have drastically affected my mental health at that point. And that just comes down to feeling like I was an individual receiving care, not a number getting boxes ticked off. Having them actively listen to me when I said, you know, I've definitely been in the exact same situations where I've been expressing a pain, I've been expressing something, and it almost wasn't taken seriously until the healthcare professional vindicated it with like a blood test. And there's so, like, yeah, you just don't feel, how can you feel safe if you don't have trust?
And that's exactly, I think, what psychological safety is. It's about trust in a team. And there's a researcher named Amy Edmondson, and she writes about psychological safety and defines it as the trust that you have with the people around you in your team, whether it's healthcare team or care team, that you are safe to ask questions or to raise issues without being criticized or judged, or without worry that you have made a mistake, or that you said something wrong. So psychological safety is that characteristic that a really high functioning team has, where every member feels free to say, hey, that looks like that needs to be fixed, or I think we need to look at something in a different way in this particular case. And like, every team member's opinions matter, and the leader of the team will be like, sure, I respect your you speaking up, and let's take another look at it. Let's be more careful here. Let's change course. Let's not follow the textbook to the dot in this case, because you're concerned and I respect that concern. So that's kind of what psychological safety means to Dr. Edmondson.
Yeah, I think also in terms of psychological safety, it's also a matter of removing the biases, right? Because I mentioned about the biases, about the racial biases, and that, you see someone and you automatically think, so, oh, they don't know what they're saying. But I think removing the stigma of mental health being about drugs and abuse and other things like that, because I'm sick and tired of listening to the media say the mental health or as a problem, like as politicians associate mental health with drug abuse and stuff like that, and not understanding that we have, in the health issues that we do face, we have major issues like PTSD and beyond. It's not just the PTSD that is associated with any sort of military or police thing, right? It's more beyond that, right? And so life is full of these traumas, and understanding that, right, is a big hurdle in order to overcome all these stigmas.
Thank you, Vikram.
If I
Absolutely.
could add to that, I think you're absolutely right. My grandmother was in hospital for a while, and I found that one of the things that we were constantly being pushed up against was that age bias of them just walking in and being just kind of accepting her condition because of her age versus trying to make it better and back to what healthy would look like for that individual. Yeah, I feel like it's.
Mm-hmm. Yeah, there are biases everywhere, and those biases definitely reduce the experience of patients going through the system. Our last question today is about psychological safety again. If a team was able to achieve psychological safety for each team member, the nurse, the phlebotomist, the physiotherapist, the gastroenterologist, the surgeon, the anesthetist, they had psychological safety with each other, how might that impact your experience going through the health system? This is an imagine if case. Do you think that your experiences would be different, better, worse? I'd like to hear from Miranda first, if you're okay. We'll go Miranda, Vikram, and Lauren.
Yeah, one thing I wanted to mention for the previous question, kind of around the subject of biases, what I find ironic is my PTSD was caused by the medical system and my experience with my health and how it was treated. And now that I have PTSD, if I go into the hospital and say, hey, I have PTSD from medical stuff, this is what I need to feel safe, then they don't focus on, okay, she's telling us this because she needs to feel safe. They think, oh, okay, so it's not a physical problem. Your things are caused by anxiety. And even though I can say something like, hey, I have Crohn's, I know like this isn't supposed to happen, they'll be like, oh, are you sure it's not your anxiety? Like that's always the first question. And so even though my mental health stuff is caused by the healthcare system and that I have very real physical health issues, it's assumed that, yeah, that the mental health is what's causing it. Yeah, so I just wanted to mention that. But in terms of that last question, I think if everyone had psychological safety, that would then create a safer environment for the patient. Not only would it like allow everyone to be more focused and present and do their role, but also be more focused and present for the patient and everybody's individual needs. If everyone feels safe, then I think that the outcomes will be better. Then there'll be less pressure on the healthcare system, and people would recover a lot faster.
Thank you, Miranda. Vikram, if each team member had psychological safety within themselves, and how might that change the experience in the health system for you?
I think it would improve the system, the fact that I'd feel more comfortable, I'd be more listened to and respected based on my experiences. I think ultimately it's about it's a matter of walking through the patient's eyes, or I guess patient's shoes, and looking through the patient's eyes, so to speak. I think that is where once the other side of the coin or the ACP or whatever it is needs to be able to do that. Once they've done that, that's when they realize that, you know, you walk through some heavy shoes at some time and you need help with this, right? I mean, it goes back to actively listening to what it is that we're sharing, or what, because obviously, in a sense, the medical system is correct the fact that we know our bodies best as individuals, right? We know how we're feeling and what's happening, where the pain is, and stuff like that. And the idea is that rather than a test showing them, they have to understand that maybe the patient is onto something. We need to really listen to what he or she is saying, right? And I think going forward, I think that's where that psychological safety. I mean, yes, I'll feel better knowing that the entire team is on the same page, right? I don't have one or two outliers. They're not believing me at all, and right, they're not willing to be. I guess look at the teamwork and try to work as a team. But psychological safety, I think, again, it's the two words I think put together. That's what comes with it, really.
Thank you, Vikram. And Lauren, what would it mean for your experiences going forward if team members in your health team all had psychological safety?
I feel like it's very much in line with like everything else that we talked about. That's, to me, it makes me think of like right now, as we're talking about them, their cup is too full and it flows over. But having psychological safety just means that they actually have room in their cup to listen actively, to address things that come up, to, like, I don't know, I've been in situations, in work situations, where you go in and it's a horrible job, but the people are happy and you have fun and you engage. And I feel like that really comes across to the customers that saw that in a different way. Like, you can tell when you walk into a place and people enjoy what they're doing and are invested. And when you are able to have that level of engagement in work, I feel like it allows you the capacity to care. Like, I think that cupful analogy was making me think, and also like so many other things. Like, there's a real thing called empathy fatigue, right? How is that really considered with each individual healthcare professional's role? Because I've heard it talked about in the animal care field, I've heard it talked about in nonprofits, but I really haven't heard about something that within the job is taking care of that for each of the individuals, because it can be really draining on a day-to-day basis. And if everybody is coming in with, she's persistent, if everybody is kind of coming in that mentality, like, I've been at a great job and everybody that showed up had a poor attitude, and it made it a horrible experience. It just made it a slog to get through, and it just infected everybody's happiness as well as the customers. So I think it would make a world of difference.
Thank you, Lauren. You used the word infected, and I think that's actually really well chosen. I think within workplace cultures, like the operating room culture of the nurses, the techs, and the anesthetists and the surgeons, that how each physician or each health professional brings themselves that day, their attitude and how well they are, how much space they've left in their cup, how they've managed their empathy resources, how aware they are of empathy fatigue. That would really, I think, infect or be an infectious thing. It could be a great thing at bringing peace, like a peaceful energy, or it could be a happy or energetic energy, or it could be a judgmental and critical and rushed, non-present energy, right? So I think your term of infection, of infectious, of how someone brings themselves, I think that's really important for our health systems and our health professionals to recognize that there are emotional contagions that go around in teams that really impact the patient's experience. I want to thank you all for volunteering pretty much, 2 hours of your time with me. I can guarantee that as we said, that I would share this with the wider public, and thank you guys for being okay with sharing your personal stories with people on YouTube, and also with mostly health professionals who I'm going to be sharing this with. There's actually a Facebook group for health professionals that I'll give you guys the invite to, so you can see it being shared and see the comments put onto this this post. We'll also be sharing it within health OR teams within my local context in Surrey and New Westminster. Do you guys have any last things to say? Because we've hit 6:33. So anything you'd like to add before I let you guys all go?
I have a question quickly. In terms of, I think the people that really need to see this are just the, I think doctors of BC, nurses of BC, as well as the administrations of the health authorities, and possibly even politicians at the Ministry of Health. I'm lucky enough that I know a few people here and there that we can try to get the word out, I think, ultimately, but people have to take the time to actually listen to hear what we're saying on the video, as well as what, everybody else has to say, right?
Yeah, I recognize the importance of editing to ensure that there are palatable versions for people with different amounts of time. So I'll try to make a quick 5-minute cut, maybe a 30-minute cut, maybe a 2-hour cut. We'll leave maybe a full-length version for anybody who's really interested.
Yeah, some like a trailer to the highlights and then, you know, encourage people to see it, right? Bring out the popcorn or whatever. So.
I think it was a really important conversation. I've never had a conversation like this with patients, and I think many of these concepts will be inspiring for people because they inspired me today. They inspired me today to be more present with my patients, to make sure that I'm being more communicative, that I'm creating safety for my patients going forward. And, you know, I hope that, you know, that's all I can guarantee for you, and that I'll share this with whoever I can share it with.
And also should share something with both all of you guys. There's already a film that I'm already on YouTube. I already have my own I already have my own page on IMDb, so I'm just not a celebrity yet.
Wrong Way to Hope. Okay.
You search that on YouTube. The film is there. It's 70 minutes long. It's about young adults, and we're all talking about our experiences and cancer and stuff. So oncology specific, but not too specific. It's more about our stories and stuff. And I think it's definitely very insightful. I think it might help you later on. In terms of Lauren and Miranda, I think you guys might enjoy it and might see some similarities of what you've been through, and you know the fact that, you know, no one's really listening to you when they're supposed to, right? So yeah.
Thanks, Vikram. Anything else to add? Otherwise, I'm gonna just say good night. No? Okay.
I have
Thanks,
something.
Go ahead. Yeah. Okay. Go ahead.
A book, and it's called My Leaky Body by Julie Deville. I don't know how to spell the last name very well, but it's a book that I found a while ago, and it was a woman that was going through Crohn's and colitis situations and found that these very similar experiences. But in the book, she actually morphs into a position where she goes and she educates healthcare professionals about what the patient is experiencing. So I feel, and she's in Canada, and I think she was working in Toronto, if I am correct or mistaken. But I feel like she's already created a position to advocate for patients, to create educational components for healthcare professionals. So I feel like that might be a good resource or opportunity to pull from, instead of reinventing the wheel, just gathering information that's already been done.
Thank you. As you were speaking, I just ordered it from Amazon. Appreciate that. Thank you so much. Have a good night, guys, and I'll send you guys the rough edits for your guys' approval as soon as I can get to it.
Thank you. Thanks for listening to our experiences. Have a good night.
Have a good night.
That's right.
That's great.